Hi, my name's Cal Warriner and I'm a partner at the law firm of Searcy Denny. I'm here to talk to you a little bit about the differences between what we anticipate the Rejuvenate litigation to be like and the DePuy Metal-on-Metal litigation that you might have heard a lot about. Over the past 4 years, the entire industry that manufactures hip implants has come under fire for making defective devices. You may have heard a lot about metal-on-metal hip implant failures. DePuy, a Johnson & Johnson company, actually recalled its ASR metal-on-metal hip after reports of premature failure due to heavy metal contamination. The FDA has gotten involved and has actually conducted extensive hearings about the safety of metal-on-metal devices. DePuy actually sent letters after the recall to patients who received the ASR hip offering to pay for their revision surgeries. Now Stryker has recalled the Rejuvenate hip. It's probably a matter of weeks before Rejuvenate or ABG2 hip implant patients receive similar letters. That is where the similarity ends though, because the failure of the Rejuvenate is much worse than the DePuy ASR failures. If you have a Rejuvenate hip and you have not been scheduled for a revision, I'm sure you don't want to hear this. The DePuy ASR fails because the metal ball wears against the metal socket and that causes metal debris. A revision surgery involves removing the ball, which is not even connected or implanted in the patient's body. It simply sits on the end of the implant's neck. All the doctor has to do to replace it is pry it off the end of the ASR stem and pop a new one on. The cup or socket also has to be removed. But since these devices are failing so early, the artificial socket has not had time for bone to grow into the back of the socket. So a couple of taps with a remover and it pops right out and a new one is implanted. The hip is relocated and the patient is sewn up. There is very little trauma involved in this replacement or revision surgery. As we explained elsewhere in our website, the Rejuvenate does not have a metal ball or socket. Those are not the problem with the Rejuvenate. The problem is in the junction of the two-piece neck stem combination. The Rejuvenate implant is comprised of the stem, which is driven into the thigh bone. That stem is designed not to come out. It is permanently implanted far down into the bone. It is specifically designed to fit tightly into the femur and not to move. When the Rejuvenate fails, it is at the junction between this metal stem and the metal neck. To fix the problem, the surgeon must remove this permanent stem out of the femur. This is a very traumatic procedure. It involves drilling deep into the femur around the outside of the stem to free it, and then pounding with a hammer until it comes loose. It is not uncommon to fracture the femur during the removal process. If that happens, the surgeon has to put wire around the outside of the femur to hold it together. One expert we have retained said removing a well-placed femoral stem is like trying to remove rebar from a slab of concrete. Once removed, an irregular defect is left in the femur. A larger hole must be drilled, leaving far less bone, and a special revision stem must be placed. Since the Rejuvenate system was marketed to younger folks, this is tragic for them. Since you only get so many hip revisions in a lifetime, this reduces that number substantially. This is bad news for Rejuvenate patients. Fixing the problems caused by a failed Rejuvenate is far worse than typical metal-on-metal implant failures. We at Searcy Denny are very committed to helping those affected by the Stryker recall. For the latest information, check back here.